Welcome to Deep Dive Dialogue. Our topic for today is AI, a new era in digital pathology. Artificial intelligence is changing digital pathology by making it faster and more accurate. AI tools can quickly analyze images, spot problems, and help doctors make better decisions. This improves patient care, reduces error, and saves time. AI is shaping a new future for diagnosing diseases and improving healthcare. Joining us to discuss this topic is our esteemed speaker, Dr. Sahil Saraf. He is a senior pathologist at Curative. Welcome, Dr. Sahil.
Hi. Yeah.
So, Dr. Sahil, what are your thoughts on that? How AI can improve diagnostic accuracy and reduce variability among pathologists?
So I think this is a question that would require some context for the answer to be appropriate. So the context of Indian healthcare is different. The context of Western healthcare is different. So in the context, let's focus on our Indian healthcare system. Diagnostic accuracy is something that we all strive for, but not all labs are equipped the same way, and not all labs have the same level of expertise. And so this is not just a problem that is specific to us, but I think it is a little more acute in our healthcare system, as as things stand right now. And AI, what it does is it gives you more information to work with. So it will give you more data points with which to come to your decision. So AI is a diagnostic tool. It is an assistant. It is not here to replace the pathologist. And what that means is there are certain things that the AI will do better than the human being. For example, quantifying, let's say, Ki-67 scores. Right. We are not going to be counting every single cell. We will. I know nobody's going to be able to do that, quite honestly, right? But the AI is able to do that. So by default, it will have more, accurate results as a consequence of that. So these repetitive tasks that require counting, or um, basically they take up a lot of your day time in the day, right? And the most important thing in the laboratory is the time of the pathologist right now, because there is so much workload on everyone, and diagnosis is becoming more complicated day by day with the discovery of new molecular markers. Or so you need your headspace and bandwidth to pay attention to those things. Whereas these things, we are A, not doing them correctly, and B, would be done better by, we would not want to do them anyway, right? Who wants to sit and count every cell and, quantify a Ki-67 score? So, yes, so that is, I think, my answer. I hope I've answered it to
Hang
your
on.
satisfaction.
Right. My next question is, what are the biggest challenges in integrating AI solutions into existing pathology workflows?
Yeah. So the main challenge is the lack of digitization. So a very small minority of labs have access to scanners and digital images, and especially a lot of these digital images are used only for research or academic purposes. So nobody really reports digitally as part of their workflow. And until that happens, AI cannot function as a tool, because obviously you need a digitized image to allow the AI to work on such, right? And I think another barrier is, we are very bound by tradition in certain ways. We are very, we've been taught a certain way. And I think also we are very rightfully skeptical of certain things, because at the end of the day, it is our signature on the piece of paper that goes out as a report, and we are ultimately responsible. So I think it is fair to be skeptical of any new technology that comes in, but I think skepticism to the point where you forbid that technology from entering into your workspace is counterproductive, not only for us as pathologists, but also for development in general. So, I mean, AI is going to change the way we work. Right, it's not going to replace us, but as many of my colleagues keep telling me that Doctors who don't use AI will be replaced by doctors who use AI. So that is one way to look at it. And also one more factor that plays into all this is the body of literature. I think that sort of works towards that evidence gathering component of our practice. So we always like, and rightfully so, again, to practice medicine based on evidence, right? So if somebody makes a claim that, oh, this is going to solve all your problems, it's very unlikely that most of us would trust that claim. We would want to see the numbers. But it takes time for that body of evidence to sort of build up, right? Again, because it has to be peer reviewed, and the studies have to be solid. And even today we do not have outcome studies, to my knowledge. And I think that is the thing that's going to seal the deal as far as the evidence is concerned. But what we do have is strong evidence suggesting that AI does improve many aspects of the workflow for doctors, and I think that's a good place to start.
Right. And it's just beginning. I think we'll definitely get the evidence.
Yes, the evidence will keep flowing, and as more people get on board with this, as this technology becomes more accessible to a lot of people, there will be more ability to, test it in various settings. And no technology is ever going to be perfect. This evidence acts as a feedback to the AI companies as well, to calibrate and, modify the technology to best suit the needs, I would say. Yeah.
So, what role does AI play in advancing predictive and personalized medicine through digital pathology?
So predictive medicine is, so I assume that we are talking about biomarkers and the like, right? So most of the predictive medicine, as far as pathology is concerned, that I have been in, I had the chance to look at, is basically the AI algorithms trying to identify genetic mutations based on his H&E images, for example. Right. There are some issues with that, and so far there has not been a, what can you say, a foolproof ironclad algorithm that can perform that task. And I don't know, but this is only my personal opinion. I don't have any evidence to back up this claim. It's that I think the same thing that stops us from getting to the bottom of that is stopping the AI as well. Um, so there is simply not enough visual information available on an H&E image for either us or the AI to make a definitive diagnosis. And you see, now, even if these algorithms work as screening algorithms, the sensitivity has to be extremely high, right? It has to be more sensitive than the existing paradigm,
Hmm.
which is your RT-PCR or immunohistochemistry, which we have learned to trust also because they are explainable, right? We know where the results are coming from. We know how the technology works, and we are used to using that as a tool to render diagnosis. Whereas now the AI has incredible abilities to recognize patterns, and it sees pixel level information that the human eye can never see. But it goes into territory that is not really understand. We don't really understand. We don't really connect to that. So the evidence again that such an algorithm works has to be overwhelming for us to be able to adopt it in clinical practice.
Hmm. Right. And I think this will happen. This is the future.
I mean, it will happen. I have no doubt about it. I'm just talking about the present day context. I think the AI will need a little longer before it will be able to, give us results that we can use in this regard. Yeah.
So, what ethical consideration arise with the use of AI in pathology, especially concerning patient data privacy and algorithm bias?
Yeah. So, ethics is again a big part of what we do, and a lot of geographies and a lot of regulators have tried to address this question and try to balance out um, two things basically. One is the need of being, let's say, the need for data protection, and data protection getting in the way of patient care, right? So most regulators, I would say, have given more weightage to patient care, and again, rightfully so, right? That is the whole point of what we do. So that gets a little bit more weightage than data protection. And again, if I've understood the ecosystem correctly, absolute data protection is difficult to guarantee, to say the least, because even what could be considered as fortresses, military setups have been hacked at the end of the day. So if there is a willingness to hack into a system, sooner or later that system may be breached. But at the same time, we cannot let that get in the way of treating patients. That takes the priority. So anonymization of data is something that one can consider very strongly, because if the data is anonymized and it is difficult to trace back to the person who it has been sourced from, even if the data is breached, it would serve no purpose to the person who has breached the data. And other things can be considered. Now, there are geographies like Singapore that are very, very particular about this, because they have had experiences with data breaches, and they mandate that all data be saved on site, so nothing to be uploaded on the cloud.
Mm,
Now, this is very, very good for data privacy, but it's also very expensive.
mm,
So again, a geography like India may be, not so willing to spend that kind of money to put the servers on site, maintain the servers on site, and you know make sure that the data is protected, because it is no doubt better than putting your data on the cloud.
mm.
So I've just tried to broadly address this question. There are people who know more about this. I'm sure that would be better placed to answer the specifics of this question.
Right. And you being pathologist, what are your views? You have partially answered this, that how AI can impact the role of pathologists in the future, and will it enhance their work or pose a threat to their job?
So, I'll be very clear. I don't think it's going to pose a threat to the job of the pathologist. And unlike other tools like immunohistochemistry or molecular investigations, AI, for the most part, is not going to complicate the workflow. What it is going to do, at least in the immediate foreseeable future, is automate repetitive tasks that take up a great deal of time, and free up this time for the pathologist to be more focused on what requires thought, or what requires knowledge, what requires experience that they have gathered over so many years of practice. And it would correctly place these things to the benefit of the patient and the pathologist. So this is what I would say in a nutshell. Now, even diagnosis as such is moving away from morphology. Like, for example, if we just take one example where we have endometrial carcinomas, POL-E mutated carcinomas carry a better prognosis, and that is more important than T scoring also, right?
Mm,
So, I mean, we are looking at a time when molecular and other ancillary tests are going to carry more weight than the morphology itself. So we are going to change the way we work
mm,
anyway, because
mm,
technology does that.
mm,
If you look at the way we worked 100 years ago and the way we are working now, there's night and day, difference between
mm.
these things. But that's just the way things go, and I think the way we practice is bound to change in our lifetime, and AI will act as one of the moving parts of that wheel. you know so we have to take it in a holistic sense, and AI will play a role, but it will not be the be all and end all of everything, because there are other things and other processes involved in the diagnostic process, where the AI does not really play a role as of now, at least.
Right, fully agree. And I think it's clear that AI is bringing exciting change to the field of digital pathology, and it's just the beginning, and we have to explore its full potential. Thank
Yes,
you, Dr. Saraf, for joining us today to discuss this important topic. Have a great day.
it's been my pleasure. Thank you so much for having me.
Thank you.